Upper cervical changed my life. I'll give you an abbreviated story. So my name is Jaime Browning. I am a DC. I'm also a diplomate in craniocervical junction procedures and a fellow. I am the technique department chair at Sherman College. I'm also a professor, and I'm also the chair of the Institutional Review Board for Research. Currently, what I'm involved in is I run a department. I am a full-time professor. I also do research, and I have a part-time practice in complex cervical case space. So I also have 3 children. I have a 19-year-old, almost 20-year-old in college. She's about to start her junior year. I have a 13-year-old and an almost 10-year-old. So we're very busy. I have a lot to do. I travel around the country speaking. I also travel around the country training with a lot of different paraprofessional groups that kind of interact with our world and try to incorporate what we do into their space and vice versa. So I seem to be a pretty good mediator for that, and that seems to be a talent that I have. I don't have a lot of talents. That's kind of one of them, and so I've honed in on that skill set, and that tends to be where I focus. I played volleyball in college, played since I was in 7th grade, and I played all the way through school. It actually was my ride to school, and I ended up going into the military as well as a reservist. And in that process, the whole time, I did a lot of wear and tear on my neck, to where I was having severe migraines. I had gotten phonophobic. Photophobic means I couldn't take light and sound. To be honest, I projectile vomited a lot. I had a lot of issues. And when I played college volleyball, the doctor on staff had me on everything short of a narcotic. Even experimental stuff at that time was meds shot up your nose, dissolvable tabs in your mouth, a quick response. And nothing really seemed to help. It really kind of just helped me survive. So flash forward, I find my way into chiropractic school. That's a longer story we don't have time for, but I find my way into here, start getting into general chiropractic care, and that did help a little. I had a really good general chiropractic intern at the time who was really, really helpful and changed my life. In that perspective, that something was changing, and I heard Reggie Gold speak, and that's really why I ended up going into chiropractic school. And while I was here, I got introduced to Upper Cervical Care because Sherman College, that is a big foundational thing that we have here. And in the process, I had my first knee chest adjustment by Dr. Stephen Conicello, and it changed my life. It got rid of my migraines. And at that time, I'd already developed TMJ or TMD fully and IBS, and pretty much lived in a prison of my own body. So after my first adjustment, my TMD was gone. My IBS was gone within 2 weeks, and about a year and a half of, barely getting adjusted, probably 3 times max, my migraines were gone. So you can't go from being a shell of a human being and not go tell the world when you actually get freedom. So that became my story. Now that's upper cervical, and that's why I'm in it. And I have seen that with my patients. I've seen that with my family. There's a lot of stories in that way as well. And I think that that's kind of the norm. It's not actually the abnormal, right? We see people who have life-changing things that happen under upper cervical care. And so that keeps me motivated and keeps me going. My world now is to get the people who normally wouldn't consider upper cervical care to get upper cervical care. People who are in different wheelhouses and worlds and searching for help and answers that don't even think chiropractic is an answer. That's the people I chase. And the people who maybe don't do as well under general care like I did, that do better with a little more specific care, those are the people I also go for. How I got into the ICA Upper Cervical Council, because that's my first entry before the ICA. I came into a council body first, and then I'm now an ICA member. It really was Bob Brooks, Dr. Bob Brooks, who we all love and adore, who has passed away, who was one of my mentors and was like a father figure to me. He had a very big vision. He had trained with all the greats in chiropractic, Gonstead, Thompson, all of those, went to their practices and everything. And Bob has a way of pulling people together. He's a bridge builder. And his vision was, if we can get everybody on the same table or at the same table and have a conversation and grow together under upper cervical, I think we'll do better. And he was right. I think he's always right in that situation. And his big thing that he used to tell people all the time was, there's a box, there's lots of holes in the box, and everybody's looking through their own hole, all seeing that truth is in the center of that box, and they're all seeing their piece of the truth. So everybody has a piece of it, right? So we need to sit down and learn from each other. So that's how I got into the council. My first position actually was the research committee chair, because research is my passion. So I started out there. I was that for a few years, and then I pretty much jumped straight to presidency. So here I am in my second round of presidency and the third of my 4th year. And I haven't looked back. All right, so right now in the Upper Cervical Council, it's a great time for us. Our forum this past year was in Salt Lake City, and we had some really big heavy hitters. We got together as a collective, and the theme for that, we always try to keep a theme because it keeps everybody on the same page of conversation. And it was complex case-based, which is where I think our Upper Cervical Council really shines. And I tend to want to explain this a little bit because people who do not understand complex case-based or hear that and think that means we're taking our patients and referring them out. That's not at all what we're doing. We're taking them on upper cervically. We're actually giving them care. And we're seeing what other kind of support systems or what we're missing or what actually we're getting better results with and other places we're getting better results with, right? So we had all kinds of different discussions, and we even brought in a few specialists, right? We had a neurooptometrist who was amazing. We had a craniomandibular dentist who came in and spoke about things, who's a great support system for us. And again, those are paraprofessionals that love our work, and they utilize us just as much as we utilize them. And then we had Dr. Jeff Iliff, who was our powerhouse speaker, came and spoke 2 hours. And Dr. Jeff Iliff, if you do not know who he is, he's a PhD, and he is the lead glymphatic researcher in the world. He does a lot of work with Alzheimer's and so forth. He has his hands on all sorts of research, and it was his introduction to us. It actually was a first date. We had a online hour with him. We showed him with Dr. Rosa, who most people know. We showed him the CSF flow studies and so forth, and that got him intrigued. And he wanted to do a first date with us and just talk before we did anything more. So now he is excited about our work. He actually stayed and listened to our speakers, and he wants to do more with us. So we have another thing that we do in the Upper Cervical Council. We have several different products, and one of them is the special topics. And this is the thing that's launched the best for our program right now. Special topics is where we pull in a specialist who works with us, and we deep dive for about 12 hours at least of content. We had Dr. Matthew Richardson and Dr. Jeff Schulten do cone beam CT for us in Canada last year. We just finished with Dr. Frank Scali out in California, where we did what's called a pro section, which every single person that attended that was blown away by the level of content. It was almost priceless what we got out of that. And we're going to do more with Dr. Frank Scali. Dr. Frank Scali is a DCMD, and he is the discoverer of the myodural bridges. And so there's all kinds of discoveries up in the upper cervical spine that we had no idea about. In fact, I left there thinking I know nothing and I'm a specialist. So that's a special topic. So next year we are working with Dr. Jeff Iliff, the glymphatic researcher, again, who had no idea what chiropractic did or upper cervical. We got to define that for him. He's going to work with us in a 12-hour situation. So we're going to figure out what that is. We're working on a date right now, what that looks like. And that's what the Upper Cervical is. Now, members will get first advantage. So if you're part of our Upper Cervical Council, we give you a lower rate and we'll give you an earlier advantage to get one of those seats because they will be a premium. Dr. Scali's event was also a premium. And so those kind of things are going to be what we're going to push big time for our membership.